Aloha and malolele, everyone. My name is Arlene Fa, and this is my senior capstone proposal presentation. The title is Creative Pathways, Art Therapy, and Dementia Care. A little about me, I graduated from HCC in Architectural Engineering. I also graduated from Kahuku, and I started the program in the fall of 2021. My concentration is in general creative media. First, I plan to go over my senior capstone project, then my thesis statement, then my objective and rationale for my research, and then the significance of my proposed project. Scholarly research shows that creative art therapy, also known as CAT, improves symptoms of dementia. It also serves as a powerful tool to promote social connection, emotional support, and a better quality of life for patients prior to end of life stages, while also providing relief for caregivers whose physical and mental health is significantly impacted. So the driving force behind my research was to channel my grief after losing my dad to dementia into something positive and healing. I really wanted to help others who are in similar situations. As caregivers, we can attest to how essential it is to prioritize respite and caregiver health. My goal was to explore the effects of CAT on dementia symptoms, evaluate the challenges in standardizing CAT, and highlight the potential of using technology to expand access. My senior capstone plans are to build a website using Adobe applications. I plan to interview local art therapists, highlight art programs for dementia, create urgency for early detection and preventative measures, and build a community of support through art and visual storytelling and shared experiences. I aim to showcase artwork through photographs as a collective form of creative expression through the lens of dementia patients. So, what exactly is dementia? It's a general term for classifying major brain disorders that cause nerve cells to weaken and die, which results in the loss of bodily functions. So, according to a national report, if all types of dementia related deaths were considered, it would rank in the top three alongside heart disease and cancer, which is very scary. The National Institute on Aging says that mild cognitive impairment, which you have normal cognition, then MCI is in the middle, and then you have severe stages of dementia. So in the early stages, such as MCI, you have a chance to reverse brain changes, which means that you can return to normal cognition. But the scary part is that changes can start a decade before symptoms actually show, which makes it absolutely important to participate in preventative measures and to take care of your brain health by avoiding things like brain injuries. So, brain injuries, also known as TBI, increase your risk for developing dementia up to 4 times. And then quality sleep is essential for brain health because that's the one time that your brain can flush out toxins that you accumulate while you're awake. So Alzheimer's is one of the leading causes of dementia-related deaths. So my paper was about Alzheimer's specifically. And this shows that the plaque that I talked about earlier, so you have these nerve cells and then you have the plaque in between. And what happens is that the plaque interferes with those nerve cells being able to communicate. And once they don't communicate, they get weak and they die over time. So that explains why you lose bodily functions connected to those cells. But I wanted to point out that the typical age of diagnosis is around 60s and above, but there are people who get diagnosed in their 30s. So given that this is an actual fact in my research, people can be sick in their 20s and not know about it. The first significance, intellectual significance, is that this demonstrates the interdisciplinary value of combining art, health, and technology. The community significance is that it promotes awareness of dementia care solutions and it supports caregivers. So I actually didn't know before my research that we offer these types of therapies on the Big Island for Alzheimer's and dementia, as well as on Oahu. So this is in Honolulu, and I felt it was important to include that. My second significance is that brain health is the main control center of our entire body. So it controls how we think, feel, and act, and it affects our professional and personal relationships. But for Alzheimer's specifically, these are the lobes that it affects. So you can see that the temporal lobe is here, okay, and that controls short-term memory to long-term memory, and it connects memories with emotions, but also the parietal lobe, which controls language and reasoning and spatial awareness. And then in later stages, it affects the frontal lobe. So that's a huge chunk of the brain that Alzheimer's affects. And the reason why I wanted to point this out is because if you can just generally understand how the brain is affected, you can separate the diagnosis from the actual person and who they really are. And future implications are that it affects our well-being, so internal, stress management, emotional regulation, quality of life, which is external, that includes financial security and especially safety. Here is the picture that I decided to include because this sums up a lot of the issues with dementia. It's expected to reach 1 trillion as far as the cost to the nation, which is really, really bad. 1 in 3 older adults die with Alzheimer's or another dementia. And the lifetime risk of Alzheimer's at age 45 is 1 in 5 for women and 1 in 10 for men. So here we have the impact globally, economically. So of course it's going to stress, public and private healthcare systems. And in Hawaii, 50% of caregivers are the patient's child. So a lot of the patients are living at home because it's very culturally common for us to take care of our loved ones. And here is the data regarding it being as young as 35 years old, 2 billion in unpaid care. So the future implications is taking proactive steps to keep ourselves and our loved ones safe will help us better prepare and recognize signs before symptoms become severe. This was a study or a survey that I came across. Also, our mother campus was involved here, and it just goes to show that these are from the patients themselves and the caregivers and the professional patients expressing, frustration, cognitive, not being able to remember things, being distracted easily, being isolated. And then from the caregiver's perspective, fear, right? Fear of exposure. So they isolate themselves. Lack of stimulation for the people that they're caring for because they really just go to doctor's appointments, get in and out of the car. They're trying to minimize exposure that puts them at risk. And then you have the professional expressing frustration that they have to choose between the level of care that someone requires, constant cleaning where they've touched. And these are very common for dementia patients, but yet they're forced to decide based on the level of care that they require. Here is some data. You can clearly see here that Alzheimer's disease, deaths with Alzheimer's have increased 140%, while HIV has significantly reduced. But even though this is here, only 1 to 2% of the US adults believe that it's an important issue. And this number is actually a lot higher because over 75% of dementia cases go undiagnosed. And it affects low to middle income countries. Clinician stigma is also a major barrier. 1 in 3 believing nothing can be done, and this is according to the Alzheimer's Disease International. In Hawaii, mortality increased to 300%, and yet it's still not classified as a public health emergency. Here we have more data. This is just to reinforce that I did use credible sources for this information. And TBIs can include concussions, skull fractures, right? Sports-related injuries are very common, car accidents, physical altercations. So please protect your brain from injuries. Even playful things accumulate over time and can lead to things like this, such as dementia. So survival expectancy, a peer-reviewed journal, they found that the survival rate is less than 5 years, with some living up to 10 years, depending on the quality of care and early detection. So that is why my emphasis is on this for my research and also my website. Here we show that every increase in caregivers' mental health symptom raises patient mortality risk by 1.5 times. This leads to negligent or reduced quality of care, which makes the disease worse. Social withdrawal, which means decline in overall health, and behavioral mimicry, right? Patients will reciprocate emotional experiences and expressions, and this causes physiological responses as well. Here we have more data. So a systematic review, 17 studies measured cognitive function, behavior, psychological symptoms, well-being, and quality of life, with outcomes ranging from nearly 50 to 95% improvement. The study also showed improved cognitive function concerning attention, concentration, and memory. So here are some examples of art therapy or creative art therapy, right? We have music therapy. These are the parts of the brain that it helps to stimulate. And these are the benefits for dementia, improve mood and reduce agitation. Then you have visual arts therapy, and it boosts focus and reduces anxiety, helps with language skills. We have dance movement therapy, which improves motor function and mobility. And this doesn't have to be complicated. When you're thinking of movement therapy, movement in general for dementia patients or people in general is very, very helpful because it helps with circulation, it keeps them healthy. And so even if they're in their walker and they're walking around listening to music or they're just nodding their head, movement helps. And here we have poetry and writing therapy, and it shows how it helps with depression and anxiety. So again, this goes back to understanding the diagnosis and then applying the appropriate therapy. This I found across my research was very emotional for me. It shares stories of how music has helped patients retrieve memories, have brought them out of isolation and withdrawal. They used to refuse to take medications, but they were a lot happier. So I highly encourage everyone to look into this documentary. It's based on real life experiences and shows more than just these three patients in there. Here's caregiver testimonials based on credible research. So significant improvements in their loved ones' mood and behaviors. Caregivers felt more connected to their loved ones during and after participating in creative storytelling or therapy. And then this is how CAT was implemented. So you have a systematic review on that, which is also a type of art therapy. Results showed 70% significant cognitive improvement, including depressive and anxiety symptoms. And these were the assessment tools that were specifically used in the research. Here we have another research, a bibliometrical analysis of structured mandalas. And these are the types of therapies that they included, which I discussed earlier, but these are the two different examples that they provided from patients. And this is how they scored it. So 0 is classified as severe dementia, and anything closer to 30 means it's more towards normal cognition. But they also use the computer system to analyze color elements, interpret color application, and an algorithm program to measure the application of completeness. So the definition of mandalas, it's a proven art therapy tool to assess a patient's psychological and emotional status. And I provided the links there. Here's another study. They used the face stimulus assessment, which is a tool therapists use to determine a patient's emotional status, self-image, and psychological well-being, especially when they challenge with verbal communication. So these are the assessment tools that we use. They start with a neutral face, and an outline of a face, and then eventually a blank paper. But these were the key findings. Cognitive responses, the study found that individuals with dementia often have altered responses to facial stimuli. This suggests that dementia can affect how patients recognize and interpret facial expressions. Also, the emotional response, the FSA revealed that emotional reactions to faces are also impacted in dementia patients. This alteration in emotional response can affect social interactions and the ability to connect with others. Here we have another study, and this was to develop technology to assist with implementing creative art therapy. And they basically designed an adaptive e-pad system. This was based off of feedback from art therapists who work with dementia patients, but the first design was finger painting on a touchscreen with the ability to add more color options and modify the background. If the patient is inactive, as verified by the lack of screen activity and the webcam, the system will add a single color and look for a response. The second design is placing objects on a background image, such as adding leaves to a tree, and encouraging the patient and the therapist to participate with each other. The third design is a touchscreen to create simple animations by adding lines and frames. The system will give prompts and suggestions based on user activity, but its drawback is its size. So the key thing about this technology is that the art therapist has the ability to adjust this based on the diagnosis and the level of the disease progression. And here it is, the ePad 1. So this is the finger painting, the ePad 2, the tree, and the ePad 3. And this is how they have it hooked up with the webcam, paying attention to facial expressions, and so forth. So the standardization issues that I found is that there were too many variations in methodologies. And so out of my entire research, I was able to point out specific methods that were used and compile them. These are internationally recognized assessment tools, which are validated in multiple languages and cultural contexts. And the first one is for early detection of MCI. And this one is for behavioral and psychological symptoms. This one is to test the severity of symptoms based on 6 cognitive and functional domains. And the last one is a quick assessment tool for testing cognitive abilities. My target audience is healthcare professionals, caregivers, and family members, the general public, because the more people we can have speaking about this, the better, and advocates or policymakers. My proposed solution is to support standardizing CAT in dementia care through multimedia advocacy via my website, sharing its benefits, encouraging support through art and storytelling of shared experiences to build a community. My preparation and process for pre-production is to outline the layout of the website, decide on colors and types of media, secure interviews with art therapists, and get necessary permissions. Production is to create the mock-ups and wireframes for the layout, incorporate various artworks for the patients, focus on visual storytelling, testimonials, and accessibility to art programs, preventative programs, and resources. Post-production is the final testing to ensure website is working properly, after feedback, and then launch the website. Here's just one example that I thought was interesting because this website is specifically based on evidence, and it shows how art therapy can be a structured approach to dementia care. They also provided a caregiving guide, so these are just some things that I was thinking about. This one is a lot more colorful. It has videos, a guided journal, a tab specifically for art therapy. And this one provides resources and a blog for therapists who want to incorporate art therapy into their practice. This one is connecting art therapy students, which is the future, of course, to memory care facilities to help them integrate art therapy into dementia care. And I plan to streamline resources. So I had to dig for these resources myself out of fear that this could one day be my story. So I registered with the Brain Health Registry, which helps to advance research regarding Alzheimer's and other brain disorders. So I had to do cognitive testing and some other exercises, which I thought was really cool. And in 6 months, they will retest. Here's another thing that I found was very helpful. There's actually certification training programs for music and memory. And I found that Oahu does have locations that offer this to people, which I didn't know about. And if I didn't know this, I would have taken my dad here. And my last slide, I wanted to share that I will, share my personal experience with my dad. Um, it was extremely hard to take care of him, but I would do it all over again because he was the best dad. And there's a memory I specifically remember. We used to play reggae for him all the time, which I remember growing up. And I remember him pointing to Bob Marley and saying, "That's my best friend." And shortly after that, he was unable to speak. So, as much as I wanted to love and protect him, I also want the same for others. And I'm determined to help. Thank you very much.